QuickStart Guide, NHS England Chat, Continuing Healthcare Assurance Tool. Background. This QuickStart Guide helps new users of QUIQCARE Chat to familiarise themselves with the system and enable them to carry out key user functions. Chat is a complete quality and compliance management tool, letting users assign and track actions, record evidence, create audits, and manage policies and procedures and other key documentation in a single integrated environment. Chat can also be customised to include any other quality or compliance standards, and used as a wider quality assurance platform across the organisation. Chat incorporates all of NHS England's quality assurance guidance in a single online service. It provides the easiest way for CCGs, CSUs, and their partners to organise the required evidence and assurances, and give visibility of the current self-assessed compliance position. Once completed, there will be periodical reviews of the evidence by NHS England, with the ability to create collaborative action plans to drive quality improvement and ensure that the required standards are being met. There is local, regional and national reporting to ensure that all information is available to the key stakeholders. QUIQCARE is a cloud-based solution accessed on the internet using a standard browser. To use the system, you must have internet access. We recommend using Firefox, Chrome or Safari browsers for the best user experience. Early versions of Internet Explorer can cause unpredictable behaviour, and we suggest upgrading to the latest version before continuing. Firefox performs best on tablet devices running Windows 8. To get to the login page, click the link on your confirmation email, or open your browser and enter the address. Enter your username and password, which is supplied in the sign-on email. Remember that the password is case sensitive. If you repeatedly enter incorrect details, System Security will deactivate your account and you will need to talk to your support desk to have them reset. Typically, you have up to 10 attempts, so it is always best to reset your password before this happens. If you forget your password, click Lost Your Password. Enter your email address, which must be recognised by the system as the original email you signed up with, and a link is sent back to you by email. Copy the new system-generated unguessable password, log in, and then change the password to the one you will remember in the account screen. A note on passwords. We recommend that you change your password immediately you start using the system, as the ones provided initially follow a standard predictable format for ease of access before your new system contains any data. Your home page. The home page is divided into two distinct areas: the standard summary and the activity pane. The standard summary. This is the left-hand side of the home page and displays information on the present self-assessed status of compliance in the service and summarises supporting evidence and action plans. The activity pane. This is the right-hand side of the page and summarises any activities that are becoming due and other information relevant to the service. The standard summary shows the current compliance of the service against each standard. New systems will show a plain grey colour until evidence has been added and a status selected. Where evidence or action plans have been added to the standard, an icon is shown to indicate the number of items. 11 items of evidence. 2 action plans. These can be clicked to reveal the underlying action plans or evidence items associated with the standard. Adding evidence. Adding evidence is key to showing compliance, or otherwise, with the NHS England's continuing healthcare standards. To add evidence. On the home screen, click anywhere on the text describing the standard. This will open the Key Lines of Inquiry page. Select the Chloe you are working on by clicking the text. Then click the Evidence button. The Add Evidence page will open. Select the statement you wish to create evidence for on the left side by clicking the text. Enter your evidence on the right side. Enter an evidence statement that reflects your service's compliance with the guidance. Select a valid to date and an owner. This will be the person responsible for reviewing the evidence when it expires. Tip: for suggestions about sources of evidence, click on the Examples link at the upper right-hand side of the page. To access the built-in audit tool, click on the Assistant link. If you wish to support your evidence with an additional policy or procedure, you can select these from the Select Procedures drop-down box, or you can select any other sort of file by clicking on the Browse link to the right-hand side of the Evidence File selection box. Press Save once you have completed adding your evidence. Indicate your assessment of compliance by selecting an indicator colour. Tip: hover over the colour with your mouse to see definition of their meanings. Evidence Summary Report. You can get a quick overview of the evidence you have added against any of the standards by clicking Summary on the main menu. Select the appropriate standard. Click Edit to open the evidence on screen, or Print to create a paper report. The Assistant. The Assistant is attached to each of the standards and provides a useful checklist to aid you in creating relevant and suitable evidence. Select a standard you wish to add your evidence against and then click Assistant. The Assistant page opens. You can print the checklist out and use the Assistant as an additional audit tool. Any statement that accurately reflects the situation can be reused as evidence. Creating action plans. If your assessment is non-compliant with the standard or Chloe's, you should create an action plan to demonstrate that the situation is being addressed. Navigate to the Chloe screen. Select the appropriate Chloe. Click Action Plan. Enter a title for the plan and select any additional users who you would like to be copied on the plan. They will be notified by email once you have completed your action plan. Select a deadline date and a review interval or date using the date selection fields. Enter the details of your plan following the guidelines above each section. If you do not complete the plan, click on the Save link to save your work and continue later. Or, if you have completed the plan, click on the Complete link. If there are other users copied on your plan, they will receive an email notification after you have clicked on the Complete link, and they will need to either accept or reject your plan within the system before it can be implemented. The owner, the person who created the plan, will be notified by email of each acceptance or rejection. If there are no other users involved in the plan, you will be given the option to implement by clicking the link shown. Your action plan will now be live and visible throughout chat, where you can see the action plan icon. Tip: clicking on the icon will take you directly to a list which can be clicked to open the action plan. Surveys. Feedback and surveys have an important place in any assurance process and are included in chat. Click on the survey name, in this case NHS England CHC Survey Sample, to reveal some sample charts and results. Other options in the survey menu include Email. This option allows you to email a link to the survey to one or multiple recipients. Share. This shows a unique URL for each survey which can be pasted into an email or posted on a website. Responses. This allows individual responses to be viewed. PDF. This creates a formatted PDF version of the survey for distribution or printing on paper. Export. All results for an individual survey or all surveys can be exported to Excel for further analysis. Reports. Once evidence has been added and the compliance position against a standard assessed, reports are accessible from the menu at the top of the page. Note: reports are only visible to those users who have been given access privileges that include access to the Reports menu. Select your preferred report by clicking on the radio button to the right of the report name. Click on the Run Reports button. Your report will open. Tip: the resulting charts can be copied by right-clicking on them and then selecting Copy Image. You can then paste them into any other compatible application. Forum. Users of chat are encouraged to participate in the Reach Out forum to share information, raise questions, and discuss best practice. From the main menu, click Forum and follow the registration instructions. Additional information. For further assistance, click Help on the main menu or by clicking the question mark symbol at the upper right-hand side of the screen. Once you have been using chat for a while, you will begin to receive email reminders of evidence or action plans that need to be reviewed. These will appear on the home screen on the right-hand side beneath My Activities. Clicking on any item listed will take you directly to that item for review and updating.